Good afternoon. My name is Nyla Blagrove, and I'm currently a third-year biology major and NIH RISE scholar attending Spelman College. For my research, I analyzed the impact of COVID-19 and diabetes care management among African Americans. To begin, it's important to understand that African Americans are disproportionately impacted by chronic diseases such as diabetes when compared to other racial and ethnic groups. According to the Office of Minority Health, African Americans are 11.7% more likely to be diagnosed with diabetes compared to non-Hispanic whites. Furthermore, diabetes is also a comorbidity related to COVID-19, and this places African Americans at an increased risk for hospitalization, illness, and death. SARS-CoV-2, also known as COVID-19, is an infection that can cause mild to moderate respiratory illness and other symptoms such as loss of taste or smell, fever, chest pain, and again, even death. COVID-19 also disproportionately affects minority communities, such as African Americans, who are already experiencing several health disparities like diabetes. So our current research objective seeks to determine if diabetes care management has decreased since the start of the pandemic, and to add to the current literature by 1, collecting survey data on the effects of COVID-19 and diabetes care management, and 2, understanding the attitudes and beliefs associated with both. So this data was collected from May 2021 to April 2022, but the research is still in progress. Additionally, this data is based on self-reported diabetes diagnosis. The methods we used to collect our data began by first attending community events such as mass testing and/or vaccination sites and community health fairs. Then we would pass out palm cards to those attending the event, and if they met the criteria of being 18 years or older and either living with diabetes, at risk for diabetes, care for someone with diabetes, or having a family member with diabetes, we encouraged them to take the survey. If they chose to, the participants can take the survey during the community event on an iPad to complete an eligibility screening and a baseline survey, which takes about 20 to 30 minutes. Then after completing the survey, we would hand them a $20 Visa gift card as a token of appreciation. However, if they chose to take the survey at home or online, we would give them the link to the Project Peach website or have them scan the QR code on the card and tell them how to get started. And after they finish that baseline survey, they would be emailed their token of appreciation. So to reiterate, the current data reflects survey completed from May 2021 to April 2022. It was analyzed using the statistical package for the social sciences, also known as SPSS. We had a survey pool of 180 participants, and we began by analyzing our results based off the descriptive statistics. We found that majority of our survey population consisted of women between the ages of 40 to 64. So then next we analyzed the different sets of questions to better understand the relationship of COVID-19 pandemic and diabetes care and management. In Figure 3, we analyzed if the participants' diabetes symptoms have worsened since the start of the pandemic and the frequency of their high blood sugar. The dark blue line represents yes, and the light blue line represents no for the question referring to diabetes symptoms worsening. The y-axis shows how often their blood sugar was high, and when looking at the figure, we can determine their correlation between the sets of questions. In Figure 4, we analyzed a similar set of questions asking if the participants' hypertension has worsened since the start of the pandemic, and what was their most recent blood pressure results. Again, the dark blue line represents yes, and the light blue line represents no, and they're referring to the question asking of their hypertension, if their hypertension has worsened. Similarly, the y-axis represents the results of their recent blood pressure, and this helps us understand how diabetes care management has been affected since the pandemic. So in conclusion, we hypothesize that since the start of the pandemic, diabetes care management has decreased among African Americans, but when analyzing Figure 3, there was no statistical significant association between how often participants' blood sugar was high and whether their blood sugar has worsened since the start of the pandemic. However, in Figure 4, there is statistical significant association between a person's blood pressure when they last checked it and whether their blood pressure worsened since the start of the pandemic. So for this association, further analysis should be done to better understand the relationship between these two variables. Additionally, to decrease the possibility of false participants, we have put survey validation measures in place to ensure that we are receiving respondents from true respondents. We did this by authenticating each participant's mailing address, phone number, and email. Thank you so much.